You're looking at Dr. Kevin Herman, vascular interventional radiologist at the Interventional Institute at Holy Name Medical Center. Good to see you, doctor.
Hey, thanks for having me.
Interventional radiology is?
It's a subspecialty of radiology that we use imaging for guidance to perform minimally invasive procedures.
Easy for you to say.
Right.
The field has grown dramatically in the last 5 years, what?
It's about 20 years old, at least, the field, but in the last at least 10 years, tremendously.
Is one of the keys to, I wrote this down, I was getting ready, it avoids large incisions and major surgeries. Is that too simplistic?
That's all true, although simple. Most of the procedures that we do, most people are familiar with cardiac catheterization, where we go through the femoral artery in the groin to get to the heart, to look at the blood vessels there. Right. Similarly, we can just do that to get to any organ in the body.
When you got into this, okay, where was the field and is it where it is today?
The interesting thing, the really interesting thing about this field is that everything that we do is based on one simple technique, which was really called the Seldinger technique, which was
the what?
Seldinger technique.
Is that named after someone?
That's named after somebody, a physician who basically was able to get into a blood vessel using a very small needle, and from there just continued to sort of grow that entry point in order to have other catheters and other devices, such as stents or balloons, be placed into the artery safely.
That hasn't changed?
That has not changed. Every dictation I write after every procedure uses that same technique, whether we're using something as simple as IV contrast dye or some very complex brand new stent that just FDA approved with drug coating on it, all the same technique.
Name some of the new procedures.
Well, it's interesting that some of the procedures are, I was actually doing a little bit of research also for the segment. There's this one new procedure that we have, which is called radioembolization.
Radioembolization?
Correct.
What is it?
And what that is actually we go through the blood vessels directly into the liver arteries. And that's really to treat liver tumors, whether it be a primary liver tumor or more commonly a metastatic liver tumor. Usually patients who have colon cancer, most common place of metastases will be to the liver. And so what we're able to do is we're actually able to selectively go into the blood vessel that feeds that area of the tumor, and we also take advantage of the fact that the artery is the one that actually supplies the tumor.
Well, hold on, why would you do that instead of surgery, standard surgery?
Well, surgery, oftentimes many of these patients are not surgical candidates.
Why not?
Usually because they have multiple lesions or multiple tumors throughout the entire liver. That's one very important reason, and we're able to really hit all of these, or blast all of these tumors either very selectively or really more globally through the blood vessels.
Give me another procedure.
Some other procedures include thrombolysis, breaking up blood clots.
Say it again?
Thrombolysis, which is breaking up blood clots, which usually form in the deep veins in the leg. And again, that's a technique that, although has been around for quite some time, we've really refined it, where it used to be sometimes 3 days in the ICU dripping this special clot-busting medication through a catheter, just dripping it in the vein, just breaking that up, to now sometimes same-day procedure, send the patient home that very same day.
Now, we were talking about this before we got on the air, PAD, peripheral arterial disease.
Sure.
What is it first? And then the thing you said to me that really threw me off was you said a lot of people don't even know they have it.
Sure.
What is it, and how could you not know you don't? How could you not know you have it?
Right. So peripheral arterial disease is basically blockages in the blood vessels that go to the periphery. So if you think of the body and the blood vessels as one big highway, there are major blood vessels that go down to the legs and to the feet. And what can happen for various reasons, diet, patients who smoke, patients that have diabetes, and just family disorders that allow cholesterol to build up, different types of plaque to build up in the blood vessels. And oftentimes this is actually asymptomatic, meaning patients don't know they have it. One of the symptoms could be calf pain when they walk, but they attribute it to arthritis sometimes. It can actually be on the realm all the way as far as having a developing ulcer or some sort of a growth that doesn't go away on the feet. And
you don't treat it, what happens?
If you don't treat it, what happens? Basically what can happen is it can actually lead to limb loss theoretically in those patients that have what we call critical limb ischemia. But I think what's more important about it is that it's a marker for other blood vessels that go to other even more important organs, for example, the heart and to the brain. So if a patient is diagnosed with peripheral arterial disease, they ought to seek care from a cardiologist, perhaps, to look at the blood vessels that go to the heart.
Well, be clear, what would you do? What's the treatment?
So the treatment, depending on how severe, we always start off with lifestyle modifications. So that would be diet, exercise. If oftentimes these patients are smokers, stop smoking immediately.
After all, sorry for interrupting, doctor. We're talking about the latest technological clinical advancements, right?
Mm-hmm.
And so many of your colleagues in the last few days, we're doing a lot of medical and health segments. So much of it comes back to smoking.
Yeah.
Still.
Unbelievable, but sad truth.
I don't know, I'm going to open up a Pandora's box as to why, but its effects on so many levels are just so devastating.
It directly affects, obviously, the known risk of lung cancer.
And you're not even talking about that right now.
Not even talking about lung cancer, but within the blood vessels, it just causes this inflammatory response as well that it's just the body does not like.
Okay, stop the smoking. What else?
Stop the smoking, exercise as much as possible, and then there's medication therapy. So there's medication directly to treat the cholesterol levels, to treat patients that have high blood pressure. You have to make sure the blood pressure and the cholesterol are at normal levels. And then we can talk about other medications. For example, if somebody's having leg pain because of it, there's some other medications that we can give to sort of increase the blood flow, better the circulation, if you will, that can do it. And then after all that, if we're still having issues, symptoms, we can go easily to procedures to open up those blood vessels.
Interventional radiology, peripheral arterial disease, so many complicated radioembolization. We've just touched the surface. Doctor, I want to thank you for joining us. Come back in the future and give us an update, okay?
Absolutely.
Dr. Kevin Herman, I want to thank you for joining us for One-on-One. Stay right there. We'll be right back, folks, right after this. Thank you, Doctor.
Thanks for